aspects. We've got COVID-19 itself has been unbelievably stressful. I mean, we all know that, but I think as a healthcare professional who is seeing it day in, day out, the emotional toll of struggling with seeing sickness in your family, potentially yourself, seeing loved ones, friends who have been unwell, the physical element of the stresses if you're working in the healthcare profession particularly, but also all of the other challenges. We know that the mental and intellectual challenge, if you're somebody who's working in the hospitals or in the community and having to get to grips with all the new stuff going on and all the new guidelines and all the new information, but also if you're at home and you're listening to announcements and you're trying to work out what to do, all of that has been so difficult. One of the hardest things we've had to deal with is uncertainty. And the truth is we don't know. We don't know what the future is going to hold. So all of that has added such a mental health burden to us. And every single person I speak to is suffering more than they've ever suffered. Now, when you add in, if you've had COVID-19 and you've developed shortness of breath or unwellness or generalized tiredness, or of course the impact on your mood, because we know that all of that has a huge impact anyway. We know that illnesses, significant illnesses, can affect our mood, make us feel lower, make us feel more tired, make us feel less able to cope with things. And now we're seeing that actually there's a crossover. There's a crossover between the impact of a long-term illness, which always affects our mental health, the fact that we are still living in a pandemic and there's so much uncertainty, the fact that we're still coping with all these new conditions of challenges of our job and our career and our children and the ones we loved, and trying to keep all of that in and be strong and say, well, I'm not going to let them know how affected I am. And actually, all of that is causing us, especially if you have had COVID and you've developed long COVID, to have long-term mental health illness and feeling unwell. And I think if you're somebody who's hearing this and saying, wow, do you know, my mood has been a bit more off. I've been feeling a bit more irritable. You know, my sleep hasn't been right for a few months. I don't have the energy or enjoyment in things I used to. These are signs, subtle signs, that your mental health is not what it once was. And actually, that's when we want you to come forward and say, look, we're here to support you through this.